Hello, so today we're going to be talking to you about some neurorehabilitation techniques specifically for a stroke patient. So the more technical term for a stroke is a cerebrovascular accident, or a CVA. And this is when there's damage to the brain from the interruption of a blood supply. It's usually when there's a blockage in like an artery or vessel that goes to the head that will be blocked and cause the stroke. This causes deficits on one side of the body, such as like one side of the face might be drooping or feeling numb, speech difficulties, muscle weakness on one side of the body, difficulty walking and coordinating, and then overall just fatigue and numbness. So our specific client is a 70-year-old male who obviously experienced a CVA 5 weeks ago. And his left side of his body is affected, and specifically his left upper extremity is extremely weak. So his shoulder, elbow, hand, and fingers are all pretty weak and affected. He's easily fatigued, but he enjoys working around the house, especially with tools. And he also wants to return to his office job, working with like papers and stuff like that. So that's what we're going to be talking to you about today. So for this particular intervention, we're going to be using the Brunnstrom approach. What that is it teaches patients to use their abnormal synergy patterns to their advantage. So reflexes, they're a part of normal development, and it's used as part of the recovery process in this approach. Rubbing skin over the muscle belly actually assists in muscle movement. And using both the visual and auditory systems are also going to assist in promoting movement, so that's what we're going to be doing today. There are 6 stages in this approach, but for our specific client, we're going to be focusing on the 3rd stage, where spasticity is starting to increase, and the synergy patterns, or at least some of their components, are going to be performed voluntarily. So I'm going to quick talk to you about the 6 stages of the Brunnstrom approach. So the first stage, stage 1, is when the arm is in complete flaccidity. So there's the inability to perform any movements. The second stage is when there's beginning development of spasticity, and the limb synergies or some of their components are beginning to appear as associated reactions now. The 3rd stage is when spasticity is increasing, so there's a little bit going on there, and synergy patterns or some of their components are starting to be performed voluntarily. The 4th stage is when spasticity is declining, so movement combinations are now going to deviate from the synergies that are now possible. The 5th stage is when synergies are no longer dominant. So that means that there's more movement combinations, and those movement combinations actually deviate from synergies performed with greater ease now. And finally, the 6th stage is when their spasticity is completely absent, except for when performing rapid movements. So isolated joint movements are now performed with ease. So again, those were the 6 stages of the Brunnstrom approach. So for the Brunnstrom approach, you're going to start by having your client sitting erect in a chair. And the first thing that you want them to do is cradle the affected arm. So in this instance, it's our left arm, so she'll be cradling the left arm. So the clinician is going to support the arm under the elbow right here while the patient leans forward. Now while they lean forward, they're going to focus on the trunk movement while the clinician helps obtain shoulder flexion. So once again, they're focusing on the trunk movement, and the clinician is focusing on the shoulder flexion. The greater flexion that can be obtained, the better. Okay, now we're going to go back into the starting position. We'll demonstrate that one more time. So again, they're cradling their arm, and the clinician is supporting, and as they move their trunk forward, clinician helps with shoulder flexion. Okay.
So the next technique we're going to use for this client is the neurodevelopmental treatment technique, or NDT. The basis of this technique is to increase tone in flaccid muscles or inhibit tone in hypertonic muscles. In this case, the muscles of the CVA client are flaccid, and the goal is to first normalize tone based on the NDT. After this, progression will occur to facilitate typical movement patterns. Okay, for this patient today, we're going to be using specific NDT techniques, which are going to be weight bearing on his affected left side and bilateral activities to get that affected side doing as much as it can. So we're going to use the ADL of cooking, and so we're just going to make cereal, fake mix cereal. I want a milk, so bear with me. So right now he doesn't really need two hands to do this, so he can weight bear on this left arm, pressing against the counter, put a spoon in his bowl, and he's pretty stiff. It didn't affect his lower limb, so he can stand. So he's gonna open up the cereal, both hands, and he can go back to weight bearing, pour his cereal in, and set it back down. Using both hands to put the cereal back in. Next, he's gonna need some milk. And open up the cap, use both hands, take it off. And then you can go back to weight bearing if he wants, which is good. So then he's gonna be able to pour the milk in, get nice and wet. So the next activity we're gonna use is donning a shirt. So this is to inhibit upper extremity flexor synergy. And so first thing to do is position the shirt across the patient's knee with armhole visible and sleeve between the knees. So I'm going to go ahead and do that. So the patient does this mostly with his right arm because the left arm is affected. So there, it's between his legs, you can see it. Sleeve's not down, cap. So the next step is the patient bends forward at the hips and places the affected hand in the sleeve. So I bend forward and it goes right in. And the arm drops into the sleeve. Shoulder protraction, gravity inhibit upper extremity flexor synergy. Pull the shirt up. You can sit upright. And now you can don the shirt on the non-hemiplegic side without doing that. So that's how you don a shirt. So today we went over our client, our 7-year-old male who experienced a CVA 5 weeks ago and has weakness of his left upper extremity, specifically in his shoulder, elbow, hand, and fingers. We mostly focused on his shoulder today using the Brunnstrom and NDT techniques.
There are many different ways that this can be achieved, but we just showed a few of them. So if you have any questions, just let us know and we can hopefully try to answer them for you. So thank you for watching this video and we genuinely hope that you enjoyed it.
Thanks.